Thank you for staying with us this far. We continue with what we have lined up for you today. And in case you have just joined us, welcome once again to the program. I am Jain Wambui. We want to get straight into our health segment for today, as we always do every Tuesday. And today it is all about yours and my heart. Today we're going to be having conversations around heart diseases, understanding what they are straight from the definitions, understanding what you need to look out for, and if you have picked up on a few things, the form of assistance that you need to seek when it comes to making sure that your health is in the best state that it possibly can be in. And with us in studio to help with this conversation, we have Dr. Vijaysinh Patil, who is a consultant interventional cardiologist. Thank you so much for making time to be with us today.
Good morning. Thank you. Thank you for inviting me. Today we are going to talk about heart, and everybody loves heart.
Absolutely.
Yeah.
And for those that have questions or comments, or you're just seeking clarifications, as simple or as grand or complicated as they may be, we will be sure to help and address them to our best of our ability, of course, courtesy of the good doctor right here. Now, let's just start by understanding your area of expertise before we get deeper into the conversation. And interventional cardiology, what is that about?
Yes, cardiology, it's a study of heart, and we are studying diseases of heart and vessels. And intervention cardiology is a new field which arises from last 20 years, and it has developed so much that we are treating heart without cutting body. Only for simple puncture on hand or simple puncture on leg vessels, we are treating all heart problems. We are treating all heart diseases, including valves. We are replacing valve without surgery. So intervention cardiology is a branch where we are dealing heart and heart diseases without much surgery, with minimal invasion, minimal interventions. We are trying to solve the problem, and with less pain and less stay in a hospital.
And how would you, or rather, what are the statistics given in the Kenyan space from what you have said when it comes to heart disease and its prevalence in our country?
Right. Looking to the Kenya, previously it was thinking that there were no heart problem in Kenya, but now when I look back last 10 years statistics in hospital admissions and in mortality perspective, in hospital admission now 25%, that is 1/4 of admissions are because of cardiovascular disease. And looking at the autopsy studies or looking at the hospital records, nearly 13% deaths are due to the cardiovascular disease. And it's something second highest after the infectious diseases like malaria and other. It's the second highest cause of mortality, hospital admissions. So definitely we now rethink about the cardiovascular disease. We need to learn about what are the diseases we need to take care, how we should prevent them, and that will give you a better health, and health is wealth, as all of us know.
Absolutely. And I'd like for us to just try and understand some of these most common types of heart diseases that we have been able to interact with, and maybe you could tell us a bit about them. And the most common one that at least a lot of people get to know about is heart attacks. What is a heart attack to start with? And, what do we need to know or be wary about when heart attacks are involved?
Right. If you're looking at cardiac disease, most deadly is a heart attack. So heart attack is something we should know, everybody should know, and if you treat in one's life. So heart attack is something, if you're looking at your hand, if it's looking red, how it is looking red? Because blood is going there. So if I stop the blood to the hand, what will happen? It will become black and it will not function. Similar way, heart is having 2-3 blood vessels, and if something is blocked in these blood vessels, if they are 100% blocked, then definitely blood will not go to that area of heart, and it will become infarcted. That's called heart attack, and that part become totally damaged. And once that part get damaged, it can't revive. So if you're looking like any wound that happened to you on hand or leg, you will remain the permanent scar on it. Similar way, there will be the permanent damage on heart will be there. But heart attack, if we treat in time, like if block is there, we have multiple options, either medicine or either some injections or intervention cardiological options. If 100% vessel is blocked, if we open that with injection, then definitely that part will get survived, because at particular time, few seconds, few minutes, few hours, we can sustain with less blood supply. But in that time, if you, that golden hour, if we give the blood back to that area will become normal. And something that we need to understand as a Kenyan people, we should understand that time is important in heart attack. We are calling time is a muscle. Heart is a muscle, muscular structure, it pumps blood.
Yes.
So if we want to keep that pump good, then we need to give him nutrition, give blood properly to that area. And in blocked vessel, if we treat in time, like within 3 hours, within 90 minutes, if you give the injections of blood thinner, the vessel will get open. If we do the angiography, like we are doing from the hand or leg vessel, we are passing small tubes and we are exactly going at that block area, and we are opening that area by the intervention cardiology, and we are seeing that on the monitor. On that way, we are, without opening any chest, we are seeing the block, we are opening the block, and we are trying to restore that area with good blood flow and good nutrition.
Okay.
So heart attack, something we need to understand the concept, and then only you will realize the seriousness of it.
So blockages in veins or arteries?
Arteries.
In the arteries are what lead to heart attacks.
Yes.
That is the known cause that this is up there from medical standing.
Right.
All right. And how should you, what are some of those signs and symptoms that present themselves that can help point to a heart attack and prevent as much damage due to, especially as you have said, time is of essence?
Correct. So when you should understand that you are suffering from heart attack, what are the symptoms? Basic symptoms, if you're looking for the heart attack, if you are non-diabetic, you'll get typical chest pain. And chest pain will be on a left side of heart, or maybe on shoulders, maybe it will go to the left hand, sometimes choking like sensation in neck. So these are the common symptoms, but this common symptom will see in 30 to 40% of patient. Remaining, like if patient is diabetic, patient is having multiple comorbidities, then the symptoms will vary. Some will feel like tightness in chest only. Somebody is keeping stone on their chest. These will be the common symptom. Along with that, they will have profuse sweating. You're sitting in AC and still you're sweating. That means something is wrong. And bodies try to give some signals always. You'll feel extreme tiredness if you feel sweating unnecessarily, if you're sitting in AC and still you're feeling sweating. There is uneasiness, pain in the shoulder, chest. You need to seek medical help, and you should think about this new entity like heart attack, and you should understand it.
Absolutely, and those are the signs that we are here to help our viewers better understand. Now let us move on to another common type of heart disease, and this is heart failure.
Yes.
When you talk about heart failure, kindly enlighten us.
Yes, when I come to the Kenya, I understand here the hypertension is very common. Every now after 25 years, 30 years of age, people start taking hypertensive pills. And over a period, what happen? If you work more, what you will get tired. Similar way, if a heart works more, if blood pressure is high, you're diabetes, you're having multiple issues, if you have previous heart attack. So heart is already damaged and you are trying to give him more work. Like sick horse, you are trying to run. So that will ultimately land up in failure. So heart failure, there are multiple causes. But in Kenya, I feel hypertension is the leading cause, and along with hypertension, diabetes, and another thing is rheumatic heart disease. Rheumatic heart disease means during childhood, if they are not treated for fever, cough, upper respiratory tract with the antibiotic, the infection will go into the valves, and that valves infection remain persistent, and that will lead to rheumatic heart disease. So hypertension, diabetes, rheumatic heart disease, and the cardiac per se myocardial diseases like myocarditis, all these will lead to the heart failure. And if you're looking at the heart failure, basically in heart failure you'll get the leg swelling, you'll feel breathless even walking minimal distance, or in some patients even doing daily activities like going to the toilet, doing the daily kitchen activity, they will feel breathless. These are nearly symptoms of the heart failure. And heart failure per se is common because of you have not treated heart in a time. If you have not treated hypertension in time, if you have not treated myocardial infarction or a heart attack in time, if you are not properly controlling your diabetes, if you are not taking any medications for your rheumatic heart disease or any fevers, that ultimately lead to damage to the heart, and it will be the permanent. And yesterday only I did one case where the heart pumping has dropped from normal 60% to 10 to 15%, and his age was 50, so he's having remaining 50 years life. And how you'll do his activity with 10% of heart pumping? So for that we put special devices which can increase his heart pumping. So there are medical options, but before I always feel before going to doctor you should prevent your whatsoever preventive measures if you took in time, that will save this further deterioration of your heart and your health.
All right, and I'd like for us to talk a bit about now, what are some of these risk factors that we are exposing ourselves to that are predisposing us to heart diseases? And I'd like to start with understanding to what percentage does, genetics play when it comes to heart diseases?
Yes, it's very nice.
Family history.
Yeah, definitely. So yesterday only I was looking for why this is happening. Just only hypertension will cause, or just genetics will cause, or just behavioral changes like smoking, alcohol, excess, all this is cause. It's actually a circle. If you're looking at, there should be genetic predisposition for, like Asians are very prone for diabetes or heart disease. That way the African continent is very prone for hypertension. It's in genetics, you can't change that. In some cases like there are the cardiac risk factors which are modifiable and non-modifiable, and genetics something is non-modifiable, you can't change that. So genetics, sex means some diseases are common in female, some diseases are common in male, that we can't change. Your age, if age is growing, that we can't change. But these are the genetic, or these are the non-modifiable factors. But what is in our hand? Our hand is having the modifiable factors, and those are very important.
But allow me to just interject at that point. Do we have a lot of cases from what you have seen interacting with the different patients that are as a result of the genetic factor when it comes to heart diseases, or they are mostly modifiable factors, as you say?
Yes, any disease, like if you think of hypertension, if you have the family history of hypertension, like your father, your mother, or anybody, brothers, close blood relative are the hypertensive, you have chance to develop that.
Okay.
And what is happening, there is 5% genetic chance, and then if you are not controlling other modifiable risk factor, it will come early, it will go in severe form. Genetic we can't prevent. If in family, like in my family, if somebody is having heart attack, I have the chance of developing heart attack in future. That we can't modify. But some diseases, like some genetic small diseases, but they are very low in percentage. If you're looking at genetic predisposition, it contributes 5 to 10%.
Okay. 5
but
to 10%.
Looking at in OPD, my office, I'm looking the modifiable risk factors are more contributing to the cardiovascular diseases.
All right.
And per se Kenya is like cardiac wise, they are good genetic background. But what is happening, they have westernized everything, their lifestyle, their food habits, and the problem starts now.
Absolutely.
And that's why I have to come, I have to work for cardiac things here.
And that actually brings me to the age aspect, because as you say, we are seeing as we advance in age, there are those conditions that come about with age, and one of them has been when it comes to heart diseases. But we are seeing younger and younger people developing heart diseases and heart conditions. What factor does age play when it comes to the relationship with the health of our hearts?
See, age is the one factor which is non-modifiable, but as age increases, means some diseases are common in 60s, 70s, 80s, geriatric disease.
Yes.
Those are common, and that we can't prevent. But what is happening now, at 20 also somebody is getting myocardial infarction, like heart attack. At age of 25, they are getting hypertension. 25, 30, they are getting diabetes. And all this is happening early because of lifestyle change. I always tell my all patients, you start ABC, avoid alcohol, tobacco, become active, more active, and choose a good nutrition. If they follow these 3 ABCs, the occurrence of these diseases we can prevent. They should become more healthier by become active, choosing proper nutrition, and avoid the tobacco and alcohol. This is most important, I feel.
So most of these issues are contributed by the lifestyle that we are adopting, which consequently is affecting the health of our hearts. Now, there's someone here who is asking about congenital heart diseases, and especially in children. Tell us a bit about that.
Yes. This is very sensitive issue, and something for family, it's a very huge burden if they have the congenital heart disease.
Yeah.
And as a medical fraternity or as a cardiologist, we have multiple options. In congenital heart disease basically happen if we have not treated mother properly during 9 months. If they exposed to some drugs, some radiations, or sometimes genetically, they have not properly treated during first 9 months of pregnancy, they are chances to develop of genetic this congenital heart disease. And congenital heart disease basically we grouped as one is bluishness causing like cyanotic heart disease, and another is acyanotic, means without bluishness causing. So congenitally there may be chances of development of hole in the heart, congenitally there may be the valvular issues, congenitally there may be some anatomical problems. And now in current medical facility we have nearly 80 to 90% these congenital disease we can treat. Even a hole in the heart, I used to treat with some devices without opening baby's chest. From the leg vessel we are passing tube across that hole, we are putting device, that's button like device we'll put, and that will close the hole, and that will prevent, means lifelong it will give the cure.
Okay.
So the congenital disease are the common here, and there will be the non-invasive, like some congenital disease we need to treat with medicines, some we need to have intervention like what I doing in a cath lab, and some need surgery definitely. And important to diagnose it and treat in time is again important for congenital heart disease. Like bluishness is in baby, if you treat during the birth or after the birth, the life of the baby will be, we can extend. But if we are not neglecting that, the lifespan will reduce to 10 to 20 years only.
And that's the general lifespan expectancy when it comes to those with heart diseases. It's cut down by 10 to 20 years?
No, it's depend upon the severity of disease.
Okay. Like
bluishness of a baby or some severe, that will reduce the lifespan definitely to 20 to 30 years. But some diseases like small holes, the patient can remain asymptomatic for lifelong. That doesn't mean all congenitals. So complex congenital heart disease, the lifespan, if you are not treating in time, can reduce. But simple congenital heart disease, we can do the normal life also.
All right. I have someone here who's asking, what brings about echoes?
Yes, it's actually good question. So as you all know, you are doing the sonography of abdomen to see the structure in the abdomen. Similar way, this is a sonography. On chest, we are putting the sonography probe, and we can see the live heart on TV. So we can see the heart, how the heart muscles, how they are working, how the valves are working, and how is the function of heart, how is the vessels are coming out of the heart. And as you just was asking about the congenital heart disease, so first tool to diagnose the congenital heart disease is echo. It's a 2D echocardiography. We can see structure, function of the heart, and that will give the good idea and good anatomical and functional collaboration to treat the cardiologist what is going on inside.
All right. Now, someone else is asking, and remember, we welcome any forms of questions, simple, grand, complicated, or if you're just seeking clarification, we welcome that. Someone here is saying, I once read somewhere that there's a science behind a heartbreak. When you're going through a heartbreak, apparently your heart also tears to some degree. Is that true?
Yes, definitely. Emotional play important.
Emotional pain,
right?
yes.
All stress, all emotion definitely will cause some impact on a heart. Actually, there is one entity called Takotsubo cardiomyopathy. If somebody, your loved ones has suddenly died, or if something happened emotionally strong, in such patients, suddenly heart fails. It will, pumping will reduce from 60% to 20%. So any emotional impact will definitely cause damage to your heart, your all over health actually. Any stress you are going through, definitely it will. But heart fail or somebody's in love failure, it won't immediately cause anything.
All right.
But definitely long term, if you are staying in same mindset, definitely it will affect your health.
All right. Now, for most people, we are always told to mind our cholesterol levels because they affect our heart. Kindly tell us about the relationship between the health of our heart and the cholesterol levels in our body.
Yes, this is a nice question actually. Just now I told about the heart attack and why this blockage is happening. What is going inside the vessel? It's a cholesterol, excess sugar, excess cholesterol. And among the cholesterol, the LDL, that is bad cholesterol. If you eat excess fatty food, excess obesity, that will start accumulating in your vessels also. And ultimately that clog your blood vessels and that lead to the heart attack. So managing cholesterol or your lipids are very important. If you're not treating them in time, they are start depositing in your vessels. And vessel is a tube. If you're something clogging, ultimately it's going to block. So we need to control your cholesterol, and for controlling cholesterol, first you should avoid all fast foods like pizza, burger, all those things you should avoid. We are trying to get westernized thing, and we are damaging our health only. So oily fried items we should as much as possible we should avoid. A lot of people are French fries, wafers, they are taking, even for children's they are giving. Actually that is not good. We should give them fruits. That will be much better option for anything. And ultimately fried items, this fast food will land up in bad cholesterol in our body.
Okay.
And that start depositing from childhood. So this is called atherosclerosis process. And if we start this lifestyle changes very fast in our from childhood, it start depositing. Ultimately in 30s, 40s, mainly when your production or mainly you're in working lifespan of your main crucial years, that time definitely this will land up in heart attack.
Okay.
So controlling your cholesterol is very important.
It is important. So when you hear about cholesterol levels, and especially at a young age when you're told to watch your cholesterol levels, just know it has a direct impact on your heart. Now, someone else is asking, what happens when an air bubble gets to the heart?
This is something funny question. Air bubble will not go to the heart.
Yes.
But similar way, there are the condition, what it's called air embolism or the pulmonary embolism. That mean maybe is a common man as air, bubble or air bubbles are going into the heart. Basically, pulmonary embolism means some clots from your leg, they travel and they clog your lung vessels where all purification of blood happen. And if they get clogged, suddenly patient become breathless. Even sudden deaths can happen if we are not treating in time. And air bubble usually, if in pregnancy or if you are going in a deep sea diving, or you're going in a flight for long duration, that can lead to air embolism. And that is one entity can lead to sudden death or sudden breathlessness or bluishness in the lips and all that. But it's not per se, it's a very rare entity, air embolism per se. But pulmonary embolism, similar condition where the leg clots are going and clogging your lung vessels. This is very common in Kenya because it's an little higher altitude. And especially in Eldoret and all that area, again the incidence of pulmonary embolism is very high.
Prevalent in such areas.
DVT, deep vein thrombosis, pulmonary embolism, these are very common. As compared to the world statistic in Kenya, these are little more incidences there.
Okay. Now, somebody else is asking, is it true that the size of your heart is the same as the size of your fist?
We always say that your heart is like your fist.
When you fold a fist?
Yeah.
Oh, up to the wrist?
Up to the wrist. This is like it's sitting on left side of your chest.
Yeah.
It's arbitrary guide for the cardiologist or any anatomist to understand the concept of how much size is there. But it's not like always be like that. But in general, if you are 6 feet tall, and then your heart will be, as compared to your body, it will be in that size. But this is a normal anatomy. Like a fist will be the size of your heart. But if any pathology happen, it can enlarge, like heart failure at what we are talking. In that thing, the chambers will enlarge and then become big. Big heart is not good. Like you have big heart, what we are talking in general.
Which is not proportional to the size of your body?
Yeah, it's not like that. The big heart is good. It should be proportionate to your body structure. Every organ should be in proportion. God has made our machinery is very particular about every small thing He has made very particularly.
Perfect in His image. Now, as we draw the conversation to a close, looking at, what you would advise our viewers to do when it comes to better care for our hearts. It's an organ that we cannot see, we can only feel. What are those measures that you would encourage us to take up when it comes to, physically speaking, what we put in our body, our psychological well-being, all summed up together for the good of our hearts?
Yes, for prevention of any cardiac diseases or like what I was talking about, the heart failure, heart attack, all that prevent by the lifestyle changes is the first. What is meaning of lifestyle changes? Basically, you should be active. You should do any kind of exercise, mainly the aerobic exercise for at least 30 minutes or 40 minutes per day. Total we are counting in WHO is telling 150 minutes per week you should do some aerobic exercise. And in children you should have a little moderate to severe level of exercise, and in more than 20 you should have moderate kind of exercise. That should be the first. Second thing, you should choose your nutrition. In Kenya you have a lot of vegetables, lot of fruits. You should take all these fruits and vegetables more in your diet. That is second thing can prevent your heart diseases, because fruits will reduce your cholesterol, fruits you give instant energy, fruits you avoid your lipid levels, it will give proper nutrition what is required. And third thing, you should avoid all kind of addictions like tobacco, smoking, even secondary smoke also. If you're standing, somebody smoking near you, you should avoid that, and that can lead, because smoking and tobacco will cause constriction in your blood vessels, and they ultimately land up in damage inside the blood vessel and leading to the heart attack. So if these three things, if you see properly, I'm always telling ABC, if you consider these three things, you should be watchful. And in diet, you should avoid excess sugars, mainly white sugar. Avoid salt. Salt is another important aspect for the development of hypertension. And these white things you should avoid: the refined flour, sugar, and salt. It should be in moderation. You should think twice before eating all these things. That will prevent your heart diseases.
All right. And also when it comes to getting checkups and just understanding the state of your heart, how often would you recommend one gets that done?
Yes, I was looking to the Kenyan cardiovascular guideline yesterday only.
Yes.
And actually, for anybody is having risk of development of heart disease, means in family there is a risk, or whose lifestyle is not good, they should do their checking in their 30s. Male patient means men should check them by 35 years of age. And those who are having no risk factors, they are healthy. In family also there is no risk of any health cardiac diseases. In those patients, they should check their in 40s, means 40 to 45 years of age. You should do your annual regular checkup. Just before development of disease, if you diagnose in time, if you treat before development of a heart attack, if you treat the block, definitely there is no damage to your body, no damage to your heart.
Okay.
So for high risk patient, at least 35 to 40 I usually consider for the screening, and for low risk 40 to 45 years of age.
Okay. Now before we get to close, let us just address some questions that keep coming in, and now it's in regards to the devices that are put in our hearts, and someone is asking how safe are they when it comes to, you know, given they are actual gadgets that can be manipulated.
So devices, looking from the stent to the bigger devices like CRT and pacemakers. So it's needed, means if your vessels is collapsing and you need to put a stent to prevent that, that is necessary. If you're not doing that, the vessel will collapse and you will end up in heart attack. But some devices, like they are putting into the chest or below your collarbone, like pacemaker and CRT, if it is needed, definitely we require to put. It's not like we should avoid unnecessarily. If your heart rate is 30, 40, it's not increasing, you'll land up in eventually in heart failure, you'll land up in giddiness and syncope. And that time, if you have the pacemaker inside, it will pace your heart at a normal rate of 70. So it's depend upon its necessity. What is your diagnosis? For that diagnosis, is it required or not? And if it is required, it should be there.
Okay.
That's in cardiology perspective.
All right. And are they susceptible to being hacked into or manipulated?
It's as shown in some movies or some CES, maybe they are manipulating pacemaker and all that. It's not that easy. Devices are very safe until and unless you should know the serial number of that device and they have some identification mark, then only they can be communicated with some external device. But for that also separate programmer is required. It's not like you can manipulate by the mobile or something.
Yes.
But whenever such devices are there, doing some MRI or doing some CT scan, you should ask your doctor, can I do this or not? Because that may interfere. Magnetic field especially will interfere with some devices.
Yeah, that I do believe. And also, before we get to close, you know, looking at the costs that are involved when it comes to treatment of heart disease as a whole in the Kenyan space, what have you identified?
Yes, in Kenya, per se, cardiac care is very costly. But we are trying to bring this bridge in between it. So we are trying to give the echo screening camps. We are going to do some diagnostic camps so that all Kenyan people will at least get diagnosis. And if looking at the diagnosis, if we have the better options of treatment instead of going some abroad and treating, definitely that will more costlier than any other thing. If we have our health system in Kenya, proper cardiac care system, and proper screening in time, proper treatment in time, definitely you will save money, lot of money, but it's definitely little costlier than other world.
All right. Well, that brings us to a close of this conversation. We thank you for the very many questions that you have sent through. As we had said, simple, grand, complicated, we welcome all of them. This is meant to be an informative session. And of course, we have been speaking with Dr. Vijaysinh Patil, who is a consultant interventional cardiologist. Thank you once again for making time. And before we get to close, maybe just your word of advice once more to our viewers this morning when it comes to heart care.
So,
and even our fellow medics, especially when it comes to the delivery of services.
Yes. As I'm a cardiologist, intervention cardiologist, I'm working in one of the reputed hospital in Nairobi. And for cardiac things, you should be the prevention. As a general public, what I advise, you should follow ABC of prevention. And for paramedics and medics, I'll say we are doing all kind of interventions from angiography to angioplasty. Those are simple or complex angioplasties. We are doing the devices. We are doing pacemaker. We are doing CRT. We are treating valves with balloons like balloon valvuloplasty or some replacement of wall, all that surgery which all over in the world now it's a routine. So we are trying to bring here. So definitely you think of your heart, screen your heart in time and treat your heart in time.
There you go. Free advice when it comes to caring for your heart. Don't just take care of your heartbreaks, yeah? Look after the physical health of your heart. Now that brings us to a close of our health segment and consequently Good Morning Kenya as a whole. Today we're going to have to, cut down our time due to what will be coming up in a bit, and that is the live proceedings from the Supreme Court where we are expected to have a physical session. Actually, it's already underway. We are going to be having that physical session today for the mentioning and the issuing of directions on the BBI appeals. We will also be seeing the Supreme Court deciding whether the 3 judges will be stepping down from the hearing of this particular appeal. So we'll be leaving you with that in a bit. But for now, we just say thank you for staying with us this far. We will be back tomorrow morning with more of Good Morning Kenya. I'm Jain. Wambui. Enjoy the rest of your viewing.